Welcome to Nebraska Laser Eye Associates, where our commitment to leading-edge technology and advanced surgical techniques is surpassed only by our dedication to quality patient care. During the next few moments, you're about to have your eyes opened to new and exciting breakthroughs in cataract care that can help you enjoy a lifetime of the best possible vision.
I really think it's like a miracle, getting your eyesight back when you almost lost it, when you were so bad, it was so bad, And the technology nowadays is it's unbelievable.
As I look back, it was just nothing, it was so easy to do this, but I'd never had any eye surgery before. This was a big deal, but it was no big deal after it was all over. It was just really easy.
I had one eye done a week ago, and I had one eye done yesterday. There's no pain, and it was just very easy to go through. I would have done it sooner.
Here at Nebraska Laser Eye Associates, there's never been a better time to have your cataracts removed. That's because cataract surgery today is one of the safest, most successful, and most common surgical procedures performed in medicine. Each year, nearly 3 million men and women just like you have their vision restored through cataract removal and lens implantation. And according to the American Society of Cataract and Refractive Surgery, more than 98% of all cataract patients have successful outcomes.
Almost all of our patients are referred by patients' regular eye doctors. That means that they have confidence in my work and that I'm doing a good job. More than 95% of patients are going to be very happy.
Not only is our method of cataract surgery safer and more successful than conventional cataract care in the past, it's also more affordable for patients, insurance providers, and our federal government. That's because we perform the vast majority of our cataract cases in the safety, comfort, and convenience of our Medicare-approved outpatient surgery center here in Omaha. This enables us to dramatically reduce healthcare costs, saving taxpayers, insurance providers, and Medicare unnecessary medical expenses.
From a cost point of view, and this is something patients don't usually appreciate, ambulatory surgery centers in general are paid about 2/3 of what a hospital would be paid, sometimes only half of what a hospital would be paid. And there will be cost savings from having economies of scales and efficiencies that you can have in a ambulatory surgery setting. If you look at all the literature on ambulatory surgery centers, there are two major advantages. One is safety. If you use the equipment every day, if the staff do things every day, then you're going to get that safety that's there. The other big thing, it is well documented that there are much fewer complications, particularly with infection, because essentially we only have normal people here. We don't have any sick people. And all the studies do show that in terms of safety and in terms of results, that ambulatory centers are far superior, which is why surgeons like to do their surgery in ambulatory surgery centers.
I think this was more relaxing. I've been in the hospital and had surgery, and you're really scared there because you don't know what you're going to do. But after seeing the movie and everything, what they were going to do, I was kind of prepared for everything.
Just like the eventual graying of our hair and the development of those not-so-funny laugh lines around our eyes, cataracts are simply part of the body's normal aging process. In this case, it involves the eye's natural lens. This lens works just like the lens of a camera, helping to focus images on the back of the eye, called the retina. As we age, the lens becomes cloudy and starts to interfere with light passing through the lens. Cataracts are so common that more than 50% of people over the age of 60, and quite a few younger than that, suffer from cataracts. Cataracts are an age-related condition that progressively robs us of our vision and limits our activities and enjoyment of life. Common symptoms of cataracts include difficulty reading and driving at night, which can actually become dangerous. Typically, people with cataracts describe their vision as being similar to looking through a piece of wax paper, with a gradual blurring or dimming of vision. You may also be troubled by bothersome glare, halos around lights at night, and even double vision. As the cataract continues to age, frequent changes in eyeglass prescriptions may become necessary.
My vision was pretty cloudy. In the daytime, I was driving, but it was kind of blur, you know, like I was in a fog. Nothing was completely clear. I didn't drive at night because the headlights and things like that, they would really affect my eyes. And I felt nervous driving at night. I didn't feel safe, so I just didn't drive at night. And I did have glasses, and you know, my eyes would really bother me. Every day I would get a headache from the computer. I didn't think the glasses were, you know, working for me, so I decided to go to the doctor, and they told me that if I got new glasses, the same thing would happen because I had cataracts. I did think I was too young for cataracts, you know, but he told me that there were people in their 30s that have it, so that made me feel a little better, I guess.
I would be reading, or I'd go to look at the TV, and the TV would be blurry. I'd have to focus my eyes in, and the lights would bother me at night, so I didn't do that much night driving. I told my son about it, and he said, well, you better get in there and get it done. And my granddaughter said, the sooner you get it done, the better you're going to be. So I said, okay. So the next day I called and got an appointment.
Currently, there is no medical treatment to reverse or prevent the development of cataracts. Once they form, which actually begins around age 50, there's only one way to achieve clear vision again. And that is to physically remove the cataract lens from inside the eye and replace it with one of several types of intraocular lenses, or IOLs. In your parents' or grandparents' day, cataract surgery was considered risky and was usually postponed for as long as possible. Hospitalization was usually required for a week or more, and complications after surgery were frequent. Many months after the surgery, patients were fitted with thick, distorting cataract glasses or cumbersome contact lenses, compromising both their appearance and their vision. Fortunately, cataract surgery with lens implantation has undergone tremendous technological advances since the days of your parents and grandparents. This year, nearly 3 million Americans will choose to have both their vision and their lifestyles restored, thanks to this seemingly miraculous, life-changing medical procedure. In the late 1970s and early 1980s, new microsurgical techniques enabled cataract surgeons to perform cataract surgery in the morning and send the patient home the same day. Another dramatic improvement saw cataract glasses and contact lenses replaced by tiny artificial lenses, which could be implanted in the eye at the time of surgery. Doctors developed techniques to remove the cataract through smaller incisions, which speeded up healing and vision recovery. And they learned that they could eliminate many vision-threatening post-operative complications by leaving intact a thin tissue called the capsular bag, which surrounds the natural lens inside the eye.
We used to bring our patients into hospital for 5 days. The surgery would take an hour. We would schedule the surgery for an hour and a half. We would take their own lens out of their eye and not put any lens in their eye, which meant they essentially had to go around with Coke bottle glasses to see. Now, there have been a lot of advances since then. We were able to then start putting lenses into the eye. We then were able to make our incisions smaller and smaller and smaller. We rarely use any needles to anesthetize the eye. When you have a small incision, that means that things are stable during surgery. It's not as dynamic, it's more of a closed system. So it gives us a lot more safety and a lot better results because we can have that small incision.
The trend towards smaller incisions and speedier post-operative recovery continues. Now, success in cataract surgery is often measured by how well a patient sees after surgery. If you're over age 65, Medicare will cover the cost of your cataract surgery, along with a conventional monofocal lens implant. Patients electing standard monofocal lenses typically have both eyes corrected for clear distance vision, resulting in a need for reading glasses or bifocals for intermediate and near vision. In some cases, Dr. Johnston can provide patients with a broader range of vision by performing a blended vision or monovision cataract procedure. He and his staff will be happy to discuss this option with you during your cataract evaluation.
Most people for cataract surgery, we're going to actually still just kind of generally set them for distance because that's easier for them, you know, and they're very comfortable. They have a little pair of maybe glasses they use for reading, and they're very, very comfortable. Both eyes are distance. The two eyes aren't seeing distance, and it's very comfortable for them. There's a lot of patients, 1 in 5, 1 in 4 patients, that will set one eye for distance, usually their dominant eye. Most people have a dominant eye. It's like being right-handed and left-handed. So we take your dominant eye, do it for distance, because that's the most useful thing for every day, just seeing, driving, TV, moving around, just seeing the world, just kind of seeing distance. So we take that as your dominant eye for distance. And then in the other eye, we target what I like to call in-between vision, so that people can see the distance and they can see up close. As long as there's not too big a difference between the two eyes, your brain will get used to that.
As an alternative to receiving a monofocal lens implant, Dr. Johnston is now giving patients access to a new generation of IOLs that can help improve both your near and distance vision. These IOLs are designed to help reduce your dependence on glasses for most activities such as driving, working on a computer, playing golf, or reading a book. Not everyone is an ideal candidate for these lenses, and your options will be discussed by Dr. Johnston and his staff. For patients with astigmatism, Dr. Johnston can successfully treat this condition using either laser vision correction, limbal relaxing incisions, or with a toric lens implant. Because of Dr. Johnston's vast experience in treating astigmatism with patients of all ages, our results are truly outstanding. The additional costs of treating your astigmatism or receiving one of the IOLs is not covered entirely by Medicare or your private insurance provider. Limbal relaxing incisions are considered to be an elective procedure and are also not covered by most insurance companies. Our staff will be happy to explain these costs and answer any questions you may have about risks and complications. Leading eye surgeon Dr. Mark Johnston specializes in an advanced surgical technique called phacoemulsification, or small incision cataract surgery. Your procedure will probably be performed in our outpatient surgery center. For many patients, only eye drop anesthesia will be required to anesthetize the eye to ensure maximum patient comfort during the procedure. Today's modern surgical techniques allow Dr. Johnston to remove the natural lens from the eye using ultrasonic vibrations through a micro-incision of 3 millimeters or less. The natural lens is replaced by the intraocular lens, which is inserted through the tiny opening. Once inside the eye, the lens spontaneously unfolds as it is placed into permanent position. Usually, no sutures are required because the tiny incision is self-healing. Because only eye drops for anesthesia are used and no stitches are required, most patients begin to experience visual recovery on the same day of their procedure. Visual recovery and results vary with age and the general health of your eyes. However, within 24 hours, many patients are seeing well enough to return to most normal daily activities.
It has been less than 24 hours since I had the surgery. It was yesterday afternoon. My life hasn't changed a whole lot. I haven't stopped doing anything. I'm not doing anything differently. I don't have any pain, any irritation, anything. I can see, I can read. I think everything is just wonderful.
Right away, I could see the difference. By that evening, I could see, clearly from that eye. When I woke up the next morning, I pretty much could see everything. I looked out the window, I could see the pictures on the wall, because I have a lot of grandchildren, so I was seeing them just as a blur, but I could see everybody clearly. I told my husband, I'm so happy I could see everything now, My life has been changed, just by getting my eyesight. It's like getting your eyesight back, It's like almost being blind, and having your eyesight restored. So I'm really excited about it.
And he told me to wear that patch till I got home. I had to have a ride home and everything. And after I took the patch off, everything was so bright and so clear. I have a big clock up on the wall that I never really could see good until I took that patch off after that surgery. It's just crystal clear now. I couldn't hardly believe it. That's how much of a change it was.
Everything is more colorful, and I watch TV without my glasses on, and I can just see a lot better. I think now I could do the night driving. There wouldn't be no glares or anything, because it just made such a difference having this done.
Although cataract surgery today is one of the safest and most successful procedures performed in medicine, as with any surgical procedure, there are inherent risks and possible side effects associated with cataract surgery. These include over and undercorrection, possible glare and halos around lights, and the need to wear glasses after your procedure. Everyone heals differently, and results do vary. A complete list of side effects and complications will be provided in your informed consent prior to surgery. Depending on how you were referred to Nebraska Laser Eye Associates, your follow-up cataract care will be performed either by one of our doctors or by your referring primary eye care physician. It can take months or years for a cataract to fully develop. So how do you know when it's time to have your cataracts removed? The answer is simple. The time to have your cataracts removed is when you believe your quality of life would be improved if you can see better. Only you can decide when it's time to open your eyes to a brighter, clearer world.
The staff has been wonderful, and the doctor, I couldn't thank him enough. I mean, the work that he does every day, not just with me, but with a lot of people, I'm sure that they're all just as thankful as I am for being able to see when we were almost, blinded by that fog that we had in our eyes. So I really would like to thank him personally, for restoring my eyesight. I think it's like a miracle, to be able to do that to someone.
The staff and the doctors are wonderful. They're so friendly. They give you the best of care. And they're willing to answer any questions you have. And they'll help you in any way they can. They're just a bunch of wonderful people. And they're here to help you, and they really do a good job of it.
We've been living in a very fortunate time for cataract surgery. I'm old enough to remember when people had Coke bottle glasses, were in hospital for a week. And you still have to remember that in the world right now, as we speak, cataract is the leading cause of blindness. Americans are extremely fortunate to have the quality eye care that they have right now.